Morning. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning or good evening, depending on where you are. So welcome to the third day of a webinar series of International Medical Physics Week 2021, organized by Faculty of Medicine, University of Malaya. So my name is Sharizan, your moderator for today's session. So for the past 2 days, actually we get an overview of the process to include medical physicists registered under the Allied Health Profession Act and how a clinical medical physicist could get certified through International Medical Physics Certification Board, IMPCB. So, and as for today, we will hear the roles, current issues or challenges from experienced medical physicists in their field, specifically in radiotherapy, nuclear medicine, and diagnostic imaging, as well as from the regulator, Ministry of Health Malaysia. So we hope that from what they share about their respective field would give you inspiration to become a successful medical physicist. So before we start, please allow me to introduce our first speaker, Ms. Woon Yi Lee. Okay, Ms. Woon Yi Lee is a senior medical physicist at the Department of Radiotherapy and Oncology, Sarawak General Hospital. So she obtained her Master of Medical Physics from University of Malaya in 2015. And in 2019, she became subject matter expert in medical physics, radiotherapy by Ministry of Health. So without further ado, I would like to welcome Ms. Wu to deliver her talk. Please, Ms. Wu.
Okay, thanks, Ms. Sarizan, for the kind introduction. Actually, I've recorded my presentation. So let me share my screen. The voice is a bit soft, so you might have to turn up your volume. So let's start. Good morning, everyone. First, I would like to thank the organizing committee for inviting me to this webinar. Today, I would like to share with you our roles as a medical physicist in radiotherapy and the current issues. So who is a medical physicist? A medical physicist is a health professional with specialist education and training in the concepts and techniques of applying physics in medicine and competent to practice independently in one or more of the subfields of medical physics. In Malaysia, there are 4 subfields for a medical physicist to practice: radiotherapy, nuclear medicine, radiology, and regulatory. Today, I will focus on the radiotherapy. Let's see some introduction of radiotherapy. Radiotherapy is a treatment based on the use of generator of ionizing radiation, as shown in this picture, where the source is from outside the body, and also radioactive source in brachytherapy, where the source will enter the body to deliver a high radiation dose to a target volume containing a malignant or benign lesion, or sparing the surrounding healthy tissues. Radiation has been an effective tool for treating cancer for more than 100 years. The first patient was treated with radiation in 1896, just 2 months after the discovery of the X-ray. Rapid technology advances began in early 1950s with covert unit, followed by linear accelerator a few years later. So this is a history of radiotherapy in Malaysia. In 1955, Department of Radiotherapy, Oncology and Nuclear Medicine in HKL installed the first superficial X-ray machine, which is only 50 kilovolt. The first medical physicist completed his training and began working in HKL in 1960. In radiation oncology, services are mainly provided by the following 3 professional groups: radiation oncologists, medical physicists, and radiation therapists. Of course, with additional support from radiation oncology nurses, engineers, and information technology experts. So this is the workflow for radiotherapy. First, the patient will come for assessment. The oncologist will diagnose and decide whether to go for radiotherapy or not. If the patient agree to accept the treatment, then patient will go for stimulation. Then the radiation therapist will put some immobilization device on patient, such as mask. Then patient will go for CT scan. Then the radiation therapist will send the images to TPS, or treatment planning system. Then medical physicists will do image registration if there is any MRI or PET-CT scan. Then oncologists will do target or organ at-risk contouring. After that, medical physicists will be responsible to do the dose calculation and plan optimization. After that, oncologists will see whether the plan is acceptable. If the plan is okay, then we'll approve and go to the next step. For some advanced treatment planning technique, such as IMRT, VMAT, SRS, SRT, or SBRT, medical physicists have to do plan QA or patient-specific QA before the treatment. At the same time, medical physicists also have to do periodic machine QA. After the QA done and everything is within tolerance, patient can go for treatment. So we start with the pre-treatment imaging, which is image-guided radiotherapy, IGRT, to confirm the setup is within tolerance, and then we can deliver the treatment. So as you can see, medical physicists are mainly involved in treatment planning and QA. Now let's look at the roles and responsibilities of medical physicists in radiotherapy. I think Dr. Hafiz and Dr. Colin have shared with us this book from IEA regarding roles and responsibilities and education and training requirements for clinically qualified medical physicists. They have identified 6 roles for the medical physicists in radiotherapy, and we'll go through one by one. First, installation design, technical specification, and acceptance and commissioning of equipment. So medical physicist is an essential part of the team for the installation design and shielding of new or modified radiation therapy rooms, ensuring that safety requirements are complied with. So this is a typical LINAC room layout, the design, where this is a primary barrier for the primary beam. So medical physicists have to verify the adequacy of the shielding after installation. For equipment specifications, medical physicists have a leading role in preparing equipment specifications according to the needs of the radiation therapy facility. Also participate in the tender evaluation and purchase recommendation of the equipment. Also have responsibility for the acceptance and commissioning of equipment, including radiotherapy treatment and imaging units, brachytherapy sources, and treatment planning systems. Analyze the functional requirements for clinical use, and specify the necessary conditions for integration, compatibility, and connectivity to existing equipment. So this is our new LINAC machine installed about 5 years ago. So we have done some tests during the acceptance testing and commissioning. So for example, this is the test for electron beam using the water phantom prepared by vendor. And then this one to test the image quality for OBI. This is to test the collision. And then we test for the photon beam as well. Just sharing with you what we have in Sarawak General Hospital. So we have simulator, CT scan, This one is the latest LINAC machine, and then another LINAC. Then we also have high dose red afterloader for brachytherapy. Next is radiation safety and protection of patients, staff, and the general public. So we developed the clinical radiation safety program for radiation protection of patients, staff, and the public. Develop procedures for verifying the integrity, safe operation, and use of the radiation therapy equipment and also the accessories. Also participate in the investigation of unintended or accidental medical exposures. So this is our radiation protection program in our department. So make sure you have this warning light, radiation sign at the entrance to the treatment room, and also area survey around the bunker. So for the radiation worker, we have to keep a medical records to be updated once in 3 years. And also every radiation worker have to wear OSLD, optically stimulated luminescence dosimeter, during office hour. So the third row is the patient radiation dosimetry. So medical physicists will acquire the data needed for clinical use of treatment units and develop tables of data for clinical use. So this is what we have done for every LINAC machine installed. So beam data collection using water phantom. Then we scan for the beam profiles for different field size and also the percentage depth dose for different field size as well. Establish and perform procedures for patient dose calculation and verification. Have overall responsibility for the treatment planning calculations to assure that patients receive prescribed doses and dose distributions within acceptable degrees of accuracy. So this is the measurement we have done in different phantom. This one head and neck phantom, water phantom, and solid water. So we also perform patient dose verification, including in vivo dosimetry. This one we use the chromic film. We cut into small pieces and we can attach to the surface of the patient. Another example of in vivo dosimetry using the diode detector. You can attach the detector on the treatment field on the surface of the patient. So number 4, optimization of physical aspect of therapeutic procedures. We optimize the treatment planning process and also develop a quality management program for radiation therapy imaging, dose calculation, and treatment delivery systems. So we have 4 different TPS here. Oncentra mainly for the 3D planning, Eclipse for VMAT or MRT, iPlan is mainly for the SRS, SRT, and we also have Plato for 2D planning. So this is the process for treatment planning. First, we fuse the MRI with CT scan. After the oncologist control for target volume and organ at risk, we'll do the treatment plan, including dose calculation and optimization. Actually, this part takes quite a lot of time. And then after that, we check the dose volume histogram, check for the dose coverage in PTV, and also the dose received by the OAR. This is an example for plan QA for MRT or VMAT. We create verification plan first, and then we capture the dose delivered by the treatment machine, and then perform gamma analysis. Number 5, quality management of the physical and the technical aspect of radiation therapy. Establish and implement quality assurance program for treatment units, TPS, dosimetry equipment, and radiation therapy imaging equipment. Also calibrate radiation generators, which are LINACs, and brachytherapy sources according to a well-established code of practice. For example, this is a QAP manual from our Ministry of Health, and also international guidelines such as from APM and IAEA. Some examples for the machine QA. This is the CT simulator with the test phantom, and then the lab laser phantom, test for the laser, and then the water phantom for the absolute dose calibration, and then Lina check for the routine output check. More examples for machine QA. This is a Winston Lux test, CAT-FAM, Starshot, ISO-align to test laser and field size. Then light and radiation field coincidence. It's a portal imaging test and a picket fence test. For brachytherapy QA, we have to check the source position and source calibration every time we change the source. Number 6, collaboration with other clinical professionals. So provide consultation to radiation oncologists to establish optimal treatment technique, and also supervise technologists in the implementation of new clinical procedures, including assistance in setup and correct treatment delivery. This is one of the treatment that we have implemented, TSET, total skin electron therapy. So this photo was taken with the oncologist after the first treatment, our first patient during the treatment. And this is our nail shield that we made in-house. Another example, SRS SRT. So this is our SRS team, including oncologists, medical physicists, and radiation therapists. Thanks again for the IKN SRS team for the guidance. Let's look at the current issues. Radiotherapy during COVID-19 pandemic. Radiotherapy treatments have continued throughout the pandemic. Many cancer centers have shared their practices to protect patients and staff during the peak of the outbreak. For example, this is from Cancer Hospital in China. It's a very good paper. They encourage patients to wear masks during the treatment. I think everyone is practicing this now. Wear surgical masks, face shield, practice good hand hygiene, social distancing, team segregation practice. So how about for medical physicists in terms of treatment planning and QA? So for treatment planning, implementation of hypofractionation to reduce the number of visits needed. Avoid complicated treatment plans and minimize the use of beam accessories to reduce the therapist's time of contact with patients. With proper equipment and training in remote planning, medical physicists can actually support treatment planning off-site, meaning that they can work from home. So for QA, schedule all machines and patient-specific QA after treatment hours or over the weekends. Enter the treatment rooms after the patient and therapist left the area to avoid cross-contamination. Some challenges for medical physicists in radiotherapy. The development and widespread use of high-tech radiotherapy has led to an increased need for medical physics involvement. These changes have opened new challenges for medical physicists. In October 2019, Astrophysics Committee has identified the 4 grand challenges. First, target definition transform from an art to science. Second, development and implementation of artificial intelligence in radiation oncology. Third, modeling biological effects in the era of personalized radiation oncology. Last one, leadership in the changing world of radiation oncology. These are my references. With that, thanks for your time.
Okay, thank you, Ms. Woon, for the insightful lectures about radiotherapy, what the medical physicist doing in a radiotherapy department. So I can see here that we have 161 attendees already, and we have one question for you. But then please stay tuned, all of you, until at the end of the session, because the Q&A session will be held after all the speakers will speaking, all right? So one more thing I want to share, the housekeeping announcement. So for the housekeeping announcement, all delegates will be muted, only listen mode for the entire webinar to avoid disruptions. If you have any questions, please submit them through the Q&A tab that you should see at the bottom of your screen. So don't forget to turn up your volume to be able to hear the presentation clearly. So make sure that you're able to see the slides being projected. If you don't, please re-log in again, and that should solve the problem. If not, please alert us on the chat function, and our technical team will assist you. So you will receive an email after the webinar to fill up the feedback form. So kindly complete the feedback form. Upon completion, an e-certification will be emailed to you. So I will continue for the next speaker. So our second presenter, our second presenter is Mrs. Azlin. Mrs. Azlin Muhammad Zain. So she is a medical physicist in University Malaya Medical Center, Kuala Lumpur, Malaysia. So she has served for more than 25 years in medical physics. So initially, her working areas has involved both irradiating apparatus and radioactive substances. So she is a radiation protection officer for ionizing radiation activities in UMMC and also UMSC. So as a head of medical physics unit, she is very much involved in all administration works as well as clinical works. So Mrs. Aldin has been recognized as Radiation Protection Advisor, RPA for Industry 3, Gauging, Sales and Norm under jurisdiction of Atomic Energy Licensing Board ALB. So based on her excellent services in health and patient care, she received an award, Ahli Ahmad Shah Pahang AAP Medal by Sultan of Pahang in December 2004, and later in late October 2020, again, she had been awarded Ahli Mangkunegara AMN Medal by DYMM YDPA. So please, Mrs. Azin, you can continue with your lecture.
Can you hear me? Can everyone hear me?
Yes, yes,
okay.
We hear you.
All right. So, okay, today is that I'm going to talk about the medical physicists, the roles of medical physicists in nuclear medicine. So let's go to the next slide, where we will have the background of the medical physicists actually. Okay, so the nuclear medicine, what is the origin of the nuclear medicine? Actually, is from the disciplines of both chemistry and physics. So it will, this was noted when Marie Curie was awarded Nobel Prizes in both fields. And also we know that chemistry was central to the discovery of productions of the radionuclide, where these are suitable to the use in humans, and also already is essential to involving clinical practice. And nuclear medicine is equally important where it developed the instrument and image analysis tool for measurement and depiction of the in vivo radio tracer distribution that has involved in the range of the scientific discipline. Okay, the group of scientists which referred to as medical physicists, this one include the physicists, engineers, computer scientists, mathematicians, and statisticians who all contribute to the technology development that underpins nuclear medicine. So selected historical will highlight the continuing significant clinical impacts that medical physics contribute to the field. So let's see what is medical physicists in nuclear medicine do. So what is nuclear medicine? First, you need to know what is nuclear medicine. So nuclear medicine has its basis where they use the radioactive tracer for the medical diagnosis and therapy. Since the inception of discipline, that the adoption of scientific methods and instrument has been central to its development and practice. Even today, also we know that nuclear medicine, at least there are the larger tertiary medical center in the larger tertiary medical centers such as UMMC or teaching hospitals, involve team individuals that include scientists, clinicians, technologists, nurses, and also ancillary staff. So this strength of nuclear medicine will be continued by its unique sensitivity, where they use the concentration of radio tracer, and they use also probe underlying the pathology, physiological, biochemical, and also molecular processes. So this exploitation, usually it will be continuous, but it also rely on the joint ingenuity of the scientific and also clinical specialists. So what is medical physics? So just now, I think Ms. Woon already mentioned what is medical physics. So medical physics is an interdisciplinary science that from knowledge, methods, and techniques of physics help to solve current problems of medicine, primarily regarding the medical imaging, radiotherapy, nuclear medicine, and also radiation protections. So this application usually is not exclusive, but in practice, it determines that the existence of the medical physicists in hospitals, clinics, or other areas of the practice of medicine. So therefore, medical physics will range their roles in the design of the equipment, procedures for diagnosis and therapy, develop a computational algorithm to understand and explain the behavior of human body, basing on the study, research, and development of ionizing radiation, non-ionizing radiation, biophysics, bioengineering, and also imaging processing. So the possibility of the research to invent or to optimize and advance of the techniques, usually it will relate to the use of ionizing radiation, visible light, electromagnetic field, synergy of the extraordinary recent development of computing resources, and also make medical physicists a specialty. Right. So from here, I would like to mention that the evolution of nuclear medicine and its roles of a clinical medicine has varied dramatically across the different countries, partly driven by the economics and also partly driven by the historical development of healthcare facilities and access. So the option of well-developed instrumentation in clinic service role for wide accept routine protocols requires minimal innovation and also customized development. So consequently, the establishment of the clinical nuclear medicine services can readily achieve with minimal specialized medical physics expertise, usually involving some consultation on radiation safety aspect, the design and operation, and also at times assist of the acceptance testing of equipment. So this practice of nuclear medicine has clinical application in virtually all systems of the body. So the contrast with the countries where medical physics has been directly involved in the early development of specialty and where established medical physics support with relevant training and professional standing has evolved. So from here, what I need to show you is that what happened to medical physicists, okay? So where do you want to be? So the aim of this summary is to further discuss the role of medical physicists in nuclear medicine and also to encourage the further involvement of medical physicists in specialty and associated development of regional medical physics training and educations. So now, when talk about medical physics, usually we have 5 goals here. The 5 goals activities involving healthcare. So in the hospital, we cannot avoid from being in the clinical support for patient care services. We also involved with technical assessment and also quality assurance program. We also have to be involved in clinical and industrial research. And in the meantime of we having giving a support for patient care, we need to have the education or we need to involve with the training. So we are also involved with administration and also a consultation management. Right. Medical physicists as important role as a member of nuclear medicine team. Usually people say that medical physicists is always work behind the screen, but they are actually important because they're giving they're giving a scientific support in the clinical setting. They also continue to innovate the validate techniques that aid the improving of quality information and also extracted the medical images as well as the effectiveness of treatment. So in nuclear medicine, the same way as radiotherapy or radiology, we are in the nuclear medicine, medical physicists also setting the radiation safety and also involved with the dosimetry calculations. So we are also involved with the instrument procurement specification, acceptance testing, and quality control. We also will have to guarantee the image fidelity that are incorporated in the commercial system that have been developed and validated, such as uniformity. All this software, usually we have to test first before you use on patient. So installation of the software for various image correction necessary for quantifications has evolved and continue to develop, including image analysis software. So all this will represent the impact on the current clinical capabilities. So physicists also in nuclear medicine, there are many active universities that based on research laboratories that continue to focus on development of medical imaging instrumentation. So we usually based on the many internationally recognized researchers contributing to the continuum of development. So in Malaysia, the medical physicist community also provide the manpower that populates the laboratory and also support staff of the any organization. Okay. So can you see on the screen here for anybody that involved with the nuclear medicine as a physicist, do you know all these face? Do you recognize all these face? Please pick up which one you recognize more. I'm sure that you know Ronjan. I'm sure that you know who is Marie Curie. So you can see the name that I already listed down based on the pictures there. Have you seen the Ron Jezek? So nuclear medicine usually use the phantom named by this Ron Jezek. Is a Jezek phantom. So usually you know what types of things phantom that you use, but you do not know that the phantom, the names of the phantom is coming from all the scientists that contribute to nuclear medicine. So this is all the faces that you should remember. So now we go to the role of the medical physicist. Role of the medical physicist in nuclear medicine is similar to the what Ms. Woon has mentioned. We are involved as a radiation safety officer or supervisor. We are also play a role as a technical troubleshooter. We are computer manager. We are also the quality control supervisor. We are developer. And also we also considered as a teacher and administrator. And we also involved as an inventor or researcher. Okay, we go. What does a nuclear medicine physicist do? Okay, just now I did mention. So the physicist is a key member of the nuclear medicine team that has specific responsibility for the scientific and technical aspect of the service. So we involve more in the quality control, whereby equipment management includes specification, acceptance testing of new equipment, as well as regular quality control of existing equipment. We also, coming from the scientific program, we also have to consider, we have to be powerful in also in the computer. So we are considered as a computer manager. So we can have we can make the data acquisition, processing covers, the design of implementation of method, the acquiring the image with the gamma camera, and also for the computer processing this data. So we should understand what exactly the data acquisition that coming with the modality. So as an inventor or researcher, we do research and development of new techniques that is often carried out as part of the multidisciplinary team. So as a teacher or administrator, medical physicists also have a role in teaching and training of many staff. So when you are the developer or technical troubleshooter, usually quality assurance is concerned with the production of a well-documented system for managing and organizing processes, and also audit is an important part of this. So radiation safety. In radiation safety, many physicists are involved with the radiation protection, work to ensure the safety of patients, staff, and also the public. So finally, in the hospital, physicists may have the role to play in the radiopharmacy or the administration of radioisotope for treatment of the of many of the areas. Okay, so we usually having a direct contact with the patient and is important as part of our job. Right. We go one by one. In radiation safety, how do you get involved with the radiation safety? Usually in nuclear medicine, medical physicists, we make sure that the safe use of radiation and appropriate handling of unseen radioactive source is increasingly covered by government legislation, which legally must be adhered to. So we also managing the radiation safety so that it will become an ever increasing drain on time with the increasing of bureaucratic burden necessitating specialized expertise. Nevertheless, in-house expertise can be very useful. So as technical troubleshooter, what do you do? So usually when vendors supply the equipment, now tends to be delivered as the integrated solution with network, workstation, and also all necessary accessory. So having the expertise in this area, usually it means that the department can integrate their own protocols with being totally dependent on the vendor supplied solutions. So in-house troubleshooting can help to identify and solve software issues that can impact on the diagnostic reliability. Okay, quality control supervisor. Right. So quality assurance should be as essential component of the studies. Usually quality control for equipment should be formed part of the daily routine. So besides the annual routine, monthly routine or weekly routine. So the key to successful of quality assurance is the ability to take the action in event of identified problems and not just recording results of QC tests. So in-house medical physicists can provide a point of contact for problem evaluation and in many cases can solve problems without necessitating visit of the maintenance engineers. So their involvement can improve management quality assurance system, whereby it's improve overall quality of services and also decreasing the downtime. So as developer, what do you do? So in nuclear medicine, we develop a new protocols. Often we respond to very specific local demands. So usually it requires innovation, flexible use of available tools, and also scientific approach to validations. So this thing you cannot do on your own. You need to discuss with all the operators. You need to discuss with the clinician that involved in the having the new protocol. Okay, so the medical physicist has traditionally played an important role in this setting and enables self-sufficiency, not only to support routine services, but also to motivate clinical research. So possessing an in-house capability, usually we undertake the development strength, whereby overall the standing in the department, we encourage a self-critical approach to service delivery consistent with modern clinical governance directive. Okay, as a computer manager, not many of us is very, very good in computer, but 10 years ago, during my university time, we are forced to learn about computer programming. So that's why previously we can do the programming manually because of we learn about the computer programming. So it's not the alternative, it's not a choice for you. So it has to be a mandatory. So there is an increasing sophistication of instrumentation used in nuclear medicine and in the methods of analysis used. So this is becoming even more complex with the introduction of multimodal system and also the expanding of the use of the hybrid machines. Okay. So the physicist can provide the advice on the sophisticated techniques and also can provide in-house training in order to maximize clinical benefits and also reduce risk of misuse. So there is important role in providing ongoing professional development of nuclear medicine staff as well as basic of teachings of trainings. Right, as an eventer, you also are not only the medical physicist in the clinical services, but also you are the inventor. So undertaking the fundamental research on instrumentation design, image reconstruction or algorithm, and also advanced image analysis methods is generalized more in the domain of university and or industry. But in the teaching hospital, we do have the lab whereby we do the research. So there is a scope of for the individual to contribute the more fundamental development, especially collaborate with the non-medical colleagues. Okay, so this one is depends on the relevant complementary expertise. Okay, as a teacher or administrator, medical physicists can make a valuable contribution to nuclear medicine management team with potential to complement the skills of other staff. Medical physicists also tend to be lateral thinker and also problem solver and can make valuable contribution to many aspects of clinical governance and also planning. So let's say the issues are coming to the end already. So we already talked about the role of the medical physicist. Now, what is the current issues that involve in nuclear medicine for the nuclear medicine physicists? Okay, generally it can be the whole lot of medical physicists, not only nuclear medicine. Okay, right now I'm focusing on the challenges. So individual medical physicists have presented many challenges actually. So the challenges will be the inhibited their input in patient care and management. How far that you are in the business. So how far that you are in the patient services, patient care services. So this is the inhibited their input. So might be their input is never goes to the managers. So this is how you want to gain or you want to get yourself get your input to be to recognized by the managers. Okay. And the other one is the gap between individual medical physicists, existing medical physicist bodies, and also the International Organization of Medical Physicists. There's a big gap because, as you know, that in Malaysia we have a statutory body, the hospital, the medical practice under statutory body. We have the medical practices under the government. We have the international organization. We have society. So there's a big gap there for now. So I hope that one day they can collaborate with each other. So a non-profit making profession, medical physicist is always a support clinical team. So this is a non-profit making profession. So then we have a qualified medical physicist versus their working experience in hospitals. So this issue also have been a challenge just to all medical physicists. We have the level of involvement of medical physicists in 3 areas, nuclear medicine, radiology, radiotherapy in the hospitals. So let goes to the next one is an issue presented. There's a few issues presented in this current situation. We have a shortage of a qualified skilled medical physicists to handle all the activities in 3 main areas. There is a lack of local training centers for clinical training in own country. So the cost of involved to obtain clinical training from the recognized trainees centers is very high. And also the lack of recognized bodies governing medical physicists in the country. Ignorance about the role of medical physicists from the hospital managers and also health ministry. We have a lack of equipment and has inhibited execution of their duties, especially in areas of dosimetry, dose assessment, and also radiation monitoring. So this has limited their participation in the research and publications. So why is limited? Because they have to do a lot of things during the day for patient care services. So they have a limited time to spend for the research and also publications. So this is all the issues that has been presented. What I know is not only in UMMC, but all over in Malaysia. So I hope that all these issues can be challenged and also can be recognized by certain bodies in Malaysia currently. Right. So for the summary, medical physicists are important members of nuclear medicine team and not only provide departments with sound advice of radiation safety and quality assurance, but provide means of supporting independent development and also research. So a challenging role for the medical physicists in nuclear medicine is that it requires a sound scientific background, a capability for innovation, attention to detail, and all above the ability to work with multidisciplinary team that includes clinician, technologists, pharmacists, and nurses. So a nuclear medicine physicist must be prepared to work with patients, and computer skills are essential as the work will often involve advanced medical image processing. So besides to be excellent in career, he or she requires to learn a soft skill of communication strategies. He or she should fall in love with their work. That is very, very important. And he or she should know to pick the right choices by doing a hard work or a smart work. And she or he should be an approachable thinker. So as for that, you can see that the useful link relates to the topic. So I already presented to you. And for the compliments, I would like to thank all my teacher, my Sifu, Professor Dr. Brian Hutton. I learned from him in 1995 during my services in UMMC, and now he's back in UK. Previously, he's in Westmead Hospitals in Australia. And also, I would like to thank Dr. Norman Kennedy. He's actually nuclear medicine consultant physicist in Nine West Hospital, but he passed away in 2015. So thank you very much.
Okay, thank you, Puan Azlin, for a very compact and informative presentation on nuclear medicine medical physicists in their clinical work and how they should have the traits on how becoming the medical physicist and overall. Okay, so the third presenter will be presenting the roles and current issue in diagnostic imaging, Mrs. Aminah Muhammad. Mrs. Aminah obtained her first degree in nuclear science from University Kebangsaan Malaysia. So she obtained her master degree in medical physics from University Malaya. So currently she is working at University of Malaya Medical Center as a medical physicist. So she is also an editor of Medical Physics newsletter UMMC and also appointed as editorial member for UMMC Bulletin. Her areas of expertise are quality assurance in diagnostic radiology, radiation protection, and also radiation dosimetry. So please, Mrs. Aminah.
Okay. Okay, good morning, everyone. You can see my voice clearly?
Yes, yes,
okay.
Yes.
Thank you, the organizing committee, for inviting me to give a talk in this webinar. And thank you, Ms. Sharizan, for the kind introduction. Hi, I'm Aminah Muhammad. I've been working at UMMC for 20 years, specializing in radiology. Today, I would like to share my knowledge and experience about roles of diagnostic radiology medical physicists. The need for physicists in diagnostic radiology. Diagnostic radiology medical physicists are part of an interdisciplinary team in the radiology department dedicated to providing safe and effective diagnosis using variety of medical imaging modalities. Other members of team include radiologists and radiographers. Medical physicists make a major contribution to the safe and effective diagnosis of patients. Their knowledge of physics, particularly in imaging science, dealing with image formation and characterization and radiation physics and how it interacts with human tissue and of the complex technology involved in modern imaging equipment are essential to the successful application of medical imaging. The diagnostic radiology medical physicists responsible include areas of dosimetry, image quality, radiation safety, quality assurance, optimization, equipment management, teaching, and research. The roles of medical physicists in diagnostic radiology can be classified in 7 areas, which is the first one is delineation of the physical aspect of diagnostic imaging system. The second, establishing and maintaining a radiation safety program. And then optimizing the clinical imaging procedures and participation in planning for resource allocation, participation in educational program, involvement in research and innovation, and last but not least, involvement with the medical imaging community and other related organizations. Medical physicists are responsible for life cycle of imaging equipment, including all the elements of planning, purchase, acceptance, and commissioning, maintenance, routine testing, and disposal. Before any purchasing of an imaging equipment, physicists need to identify a specification of new equipment performance and also involved in tender document. They also must prepare the documentation for licensing requirement under the Ministry of Health. After the installation, medical physicists must be able to perform acceptance testing of imaging modalities, and they also responsible in development and implementation of quality control program. Medical physicists must be also able to evaluate of doses from radiological procedures. This is the CT scan picture, angiography in radiology department. The medical physicist plays an essential role in performing acceptance testing of imaging modalities before clinical use. Acceptance testing is important to ensure that newly acquired modalities are well within manufacturer's specifications and allow establishment of baseline measurements for future comparisons. So we use this baseline as a reference for our routine QC test later. This is the picture showing the TNC, testing and commissioning for ESWL lithotripter, and this is MRI, that means the classification of the area, and this is the the mobile radiography system. Medical physicist program, establishing and maintaining a radiation safety programs. Okay, sorry. Okay, medical physicist QC program and perform QC testing on the full range of radiology equipment, which covers general radiography, fluoroscopy, mammography, CT scan, and also non-ionizing modalities like ultrasound and magnetic resonance imaging or MRI. The QC tests include generator performance like KV accuracy and output exposure consistency, image quality, X-ray beam alignment, and dosimetry. Medical physicists are not only able to perform the QC test, but also must understand the operation of the imaging equipment and factors that affect the radiographic output. The purpose of QC testing is to detect any changes that may result in a clinically significant degradation in image quality or significant increase in radiation exposure. This is the QC testing by physicists for digital radiography, and this is a mechanical check for the arm of mammography system. Okay. Next, the role of medical physicists is establishing and maintaining a radiation safety program, administration of personnel radiation monitoring, and as low as reasonable achievable LARA programs, participation in the institutional radiation safety committee, determination of shielding required for new or renovated medical imaging rooms, facilitation of compliance with all regulating and certifying agencies, a response to emergency situations, and review of policies and procedures related to radiation safety. The determination of shielding required for new or renovated medical imaging rooms. They should specify shielding for an X-ray facility using diagnostic X-ray imaging systems, design satisfactory radiation shielding for all types of diagnostic radiology equipment, and assess the effectiveness of the shielding. This picture showing the physicists measure the scattered radiation outside X-ray room to ensure the shielding is adequate, and this picture is the scattered measurement at the console area in mammography room where the radiographer is stand behind. So for radiation protection and safety, physicists must understand the factors that affect radiation dose to staff and patient. And then they should understand the purpose, principles, and operation of personal dosimetry program, provide personal dosimetry service to radiology department staff such as TLD or OSLD, establishing and maintain record keeping procedures for dosimetry result. This is for audit, checks of personal protective equipment, whether it is safe for use, perform a hazard assessment of procedures and facilities for staff and members of public. This is the dosimeter. This is the personal dosimeter. This is a physicist doing the RPE check for lead apron. This is a check for inventory of the lead apron for each department. So for dosimetry, instrumentation and calibration, medical physicists must have a good understanding of radiation quantities and units, formalism and uncertainty estimation dosimetry types needed for radiation measurement in diagnostic radiology. And then they have must use the selection and correct use of equipment for those measurements, including the uncertainties. Correct use of phantoms where applicable. This is the monitor for area monitoring. This is for personal dosimeter. This is the ion chamber for environmental, for radiation and scattered radiation measurement. This is another type of personal dosimetry. For optimization of the clinical imaging procedures, physicists need to monitor of patient radiation exposures, optimizing of imaging procedures, determination of specific patient and organ dose and fetal dose for a specific patient. And then must initiate education of the diagnostic imaging staff to ensure that the efficient implementation of new technology. This is for monitoring of patient radiation exposure. They measure and assess radiation dose and use the information to estimate patient dose, include adults, children, and fetus, and comparing the results with diagnostic reference levels and take appropriate action which necessary. The picture showing the physicist analyzing thermoluminescence dosimeter or TLD. The TLD has been exposed to radiation at patient and then analyzed by the TLD reader and get the result from this monitor. This picture showing patient dose measurement using unforced dosimeter while patient undertaken angiography examination. Okay, for fetal dose estimation in radiology, we have to estimate the approximate fetus dose from a pregnant patient. So for physicists, must able to calculate the fetal dose and must able to know the methodology of the dose calculation and the workflow of patient management, which is must have justification, must get the patient consent, pre-planning and fetal dose calculations, and they must also know the natural the risk of the dose to the fetus. And for example, this is a case study. For example, in CT scan, the fetal dose is this is CT thorax. The fetus dose is 0.1 milligray, and they have to calculate the risk factor. For example, 1 in 300,000. So, and then they compare to natural risk of cancer. Baseline is 1 in 650. That means the radiation dose is the risk is much lower than the natural risk of cancer. And then physicists must able to give advice for pregnant patient and explain the potential radiation effects to the patient. Okay, this is the menstrual age and the conception age, and this is the level of dose, which is less than 50 milligray. None of the probably the cases, the risk is negligible, and the risk is increased if the dose is more than 100 milligray. Okay, in participation in planning for resource reallocation, can be classified by equipment usage and replacement, development and implementation of a cost containment program, new facility design and development program and department design, budget preparation and review of the medical physics programs, policies and procedures. Medical physicists also involved in quality management. This is the document in quality system. For example, this one is medical physics unit policy, and then this is a radiation safety manual, and one of QAP in diagnostic imaging. So physicists must review all this document regularly in order to get it updated. Medical physicists also must develop the skills to be an effective educator and mentor in diagnostic medical physics. They participate in educational program, continuing safety education for imaging physicians, nurses, technologists and other medical physicists, supervision for diagnostic radiology medical physics residents, teaching for medical physics students, for radiographer students and other students in diagnostic imaging programs. Also involved in safety education for all employees in the institution who are exposed to radiation. In UMMC, we have various training programs such as Diploma in Radiography and Master of Medical Physicists. You can see this is a demonstrating QC procedure for X-ray equipment for radiography students. This is a demonstration of ultrasound QC procedure for student of medical physics. And also physicists must involve in continuing safety education for all employees in the institution who are exposed to radiation. And then continuing safety education for imaging physicians, nurses, technologists and other medical physicists. This is to share knowledge and to create awareness in radiation safety. This is a radiation protection seminar organized by Medical Physics Unit. This is a refresher course for radiation supervisor, radiation protection supervisor. This is the half-day seminar. This is the demonstration for radiation worker, and this is the radiation awareness talk for staff in trauma and emergency department. Also, physicists is involved with research and development, able to perform research in area of relevance to a medical imaging, either individually or as a member of multidisciplinary research team. Medical physicists have the vantage point to address key clinical questions pertaining to image processing, optimization, imaging protocols, or enhancing patient safety as they interact with everyone connected in the imaging chain and are aware of various issues related to imaging workflow. And they must understand the process of scientific research, including the role of ethics review, statistical analysis, and the publication process. And also involvement with the medical imaging community and other related organizations, participation in scientific meeting and conferences, participation in local, regional, and national governmental bodies addressing health and radiation issues, participation in science fairs, and we also involved with other organizations locally and internationally. This is the audit by American College of Radiology, ACR experts. They do audit and also accreditation. This is training for quality improvement, quality assurance for diagnostic radiology improvement and learning, quality of health. And then, International Day of Medical Physics, we celebrate every 7th November. And we every year we celebrate and we have activities like booths and poster presentation, and to create awareness and visibility of medical physicists' role in healthcare. Okay, and then participation in scientific meeting and conference, AOCMP, Congress of Medical Physics, and Southeast Asian Congress of Medical Physics. This is also AAPM workshop. And then for the current issues in radiology department, especially young physicists is unable to get adequate knowledge and clinical experience. A certain hospital, they don't have adequate test tools to perform QC testing. There's the need for structured and supervised clinical training of medical physicists specializing in diagnostic radiology. This is documentation by IAEA. This means to be clinically qualified to practice alone in a medical facility, the medical physics professional must have experience in a wide range situation and be able to make professional judgments based on scientific principles and experience. The objective of the clinical training program for medical physicists specializing in diagnostic radiology is to produce an independent practitioner who is a lifelong learner and who can work unsupervised within a multidisciplinary team at a safe and highly professional standard. Okay, I'm the one of the supervisor IAEA clinical training. Now we have second batch of residents. During the COVID-19 pandemic, we have difficulty in conducting the practical sessions. Under IAEA requirement, a qualified medical physicist must have basic degree physics and with using to be
Okay, thank you, Puan Amina, for the lecture. I think at the end of the lecture, it seems that we have a hiccup where we can't hear your voice that clearly. So, but we already recording your lecture, and we just can see clearly the translation of your slides. So maybe after it's been recorded, we hope we can get your voice back, but it's okay. Thank you for the lecture, and thank you for the a lot of pictures that have been shown on what medical physics in diagnostic imaging doing right now. So we move to our last next speaker, Dr. Bidi bin Abdul Hamid. He's going to talk. He's going to talk about current issues that being faced by the regulatory. So Dr. Bidi bin Abdul Hamid, his current position right now is Head of Registration Section, Medical Radiation Surveillance Division, Ministry of Health Malaysia. So he has been working for the MOH as a physicist for 26 years. This means since 1994. So he obtained his Master of Medical Physics in 2004 from Kuala Lumpur and Doctor of Philosophy, PhD in the field of texture analysis of medical images in 2012 at Cardiff University, UK. So his current research is radiation shielding for general X-ray, ELF exposure from power lines, EMF exposure for medical equipments. He also MOH representative for WHO International Advisory Committee on EMF, a committee member of Medical Physics Division, Institute of Physics Malaysia, member of Serum Technical Committee of NIR, and also involved very much in public forum, giving presentation on NIR and health for more than 10 years. So please do go ahead, Dr. Bidi.
Thank you, Miss Sharizan. Assalamualaikum and a very good morning. Still morning to everyone. I hope everyone can hear me clearly. Can you?
Yes, yes.
All right, good. Okay. Before I proceed, I would like to thank the organizing committee for inviting me on behalf of my department to share what we as a regulator do, focusing on the medical physics. As a medical physics, what we regulator do. Okay, right. So once again, thanks to the organizing committee and Ms. Sharizan. I would like to start my presentation by giving a background about my divisions as a regulator, entity in our country. So we know that in our country, we started with the Radioactive Substance Act in 1968. And then following that gazettement of the Act, in 1974, the Radiation Safety Unit was established under the Public Health Program in the Ministry of Health. And this Radiation Safety Unit is the secretariat for the DG of Health to take the functions of the Radioactive Substance Act. And then in 1981, the Radiation Safety Unit combined with the Public Health Engineering Unit and being put under Engineering Services Division. And in 1984, in our country, the new act was gazetted, replacing the previous one, which is Atomic Energy Licensing Act 1984. And then in 1992, the Radiation Safety Unit, before that, we only have in the HQ, but in 1992, the Radiation Safety Unit also was established at the state level, and at that time was in Sabah and Sarawak in 1992. But now, currently, this medical radiation, now we call it as a Medical Radiation Surveillance Unit, are established at all states in Malaysia except for Perlis. And from before 2016, Radiation Safety Unit are under Engineering Services Division. But in 2016, we have been upgraded into a division on our own, separated from the Engineering Services Division, which is called Medical Radiation Surveillance Division. And this is our organization structure. And then I will later on touch on the roles and function for each section, which reflects the roles and functions of the medical physicist as a regulator. So basically we have 4 branches, and under each branch we have 2 sections. So altogether we have 8 sections under the Medical Radiation Surveillance Division. We have licensing section, registration sections, enforcement, prosecution, code and standard, technical services section, training, and interagency cooperation. But of course, we have the administration and finance section, which doesn't involve medical physicists. So like I said, on top of HQ, role or regulatory functions is also carried out by our colleague at the State Health Department. So this is the history. The the posts that being created at the Health State Department started. This one should be 1992 in Sabah and Sarawak and the rest. So altogether, except Perlis, we have all the branch at the state level. So before I proceed, let us look at the goals of the Atomic Energy Licensing Act, because we are regulating the Act 304. So the goals of this act is to protect people as well as environment from the effects or danger of IR. So people here, as we know, it's involved patients, staff, and also public. So to ensure these goals are met, so the functions of my divisions is to regulate the use of ionizing radiation based on the requirements under the Act 304. But not only that, we also involve in providing technical advisory services and also involved in the NIR health issues. And to make sure that we can deliver a good service, we also have a function to strengthen interagency cooperation or collaboration. So this Act 304, what we control is basically can be divided into four. We have facility, we look at equipment, personnel, those who involved with the use of ionizing radiation, and also the clinical procedure that involve ionizing radiations. So these are the four elements that we look at or we regulate and control. Now, just to give a picture about the situation or scenario in our country, in Malaysia, yeah, in terms of facility that have either irradiating apparatus or X-rays and radioactive sources. So this data is up to 2020. In terms of facilities, there are 5,056 facilities that use ionizing radiations, both government and private. For the equipment, there are nearly 9,100 equipments, IR equipment. And for the radioactive sources, we have 848 sources. That is the, what you call that, the sealed source as well as unsealed source. So these are all the facilities, equipment, and sources that we control or being used in Malaysia. Not only those elements, but we also look at the workers, those who involve with ionizing radiation, or we call it as a radiation workers. And these are example of the people who involved with this ionizing radiation. We have radiologists, nuclear medicine specialists, oncologists, radiotherapists, and so on, including nurses and also medical assistants. Yeah, for example, nurses, we can divide into two. For dental nurses, they do perform as an operator, provided they have a proper training. And they also sometimes, certain nurses, they don't operate the machine, but they involve with the interventional procedure. So we consider them as well as a radiation workers, yeah, even though they are not operators. So we have to differentiate there between operators and non-operator, yeah, but they are still considered as a radiation workers. So all together, in terms of personnel that involved in ionizing radiation in our country, but I'm sorry, please excuse me, forgive me for this one because the data is a bit outdated, yeah, August 2015. So based on this data at the moment in our country, in government, we have around 6,500 personnel, and in private, we have 7,500 personnel. So all together, we have about 14,000 personnel, yeah, that we have to look into their, in terms of their safety. Okay, so in terms of responsibility or roles of the medical radiation division, or the activities that we carried out, I divided it into two. One is the core activities, which is about licensing and registration, and also enforcement and prosecutions. And then we have what we call it as a support activities, but doesn't mean that these support activities is not important. Core activities means that it's directly related to Act 304, carrying out the what we should do under the Act 304. But supporting activities also is equally important, which is medical physics services, training and interagency cooperation, and of course, we cannot run away from the fact that even though we are scientists, we have to do the administration work. And nowadays, like we see the previous speaker also talk about the ICT in the medical physics. Yeah, the medical physics, the equipment, the procedure, we cannot run from using ICT. Yeah. Okay. So what we do for the licensing and registration, or what medical physicists do. But I have to stress here, yeah, not to confuse everyone, that what in our country, in Malaysia, as a regulator, the post for the regulator not necessarily be medical physicist. It is a physicist, yeah. But mainly because we are dealing with the medical radiations, I mean the use of ionizing radiation for medical. So most of us, or many of us, have a master degree in medical physics. And our job also are very related to the medical physics work. Because for the non-medical physics, it's being non-medical, it's being catered by our counterpart, Atomic Energy Licensing Board, AELB. Yeah, for medical one is being catered by MOH physicists. So we can say that even though we are physicists, but the job that we carried out is a medical physics job. And many of us, most of us have a qualified medical physics qualifications. Yeah. So for licensing and registration, what we do is we evaluate the license and also the registration. For the private, we issue license. For the government, we issue register. So we evaluate their applications, and this evaluation includes, which related to medical physics that I highlight here is that, for example, we will evaluate the QC reports of the equipment. Yeah, sometimes we have to do the radiological environment impact assessment, yeah, shielding calculation or verification, and also the radioactive waste management, the SOP, everything, which is prepared by the licensee. So we, as a regulator, have to evaluate their documentation. And to a certain extent, we will go to the field to carry out the inspection. And also we involve in the pre-approval inspection or verification visit. And on top of that, medical physicists or physicists also will involve in review and develop circular guidelines and other documents, which is related to licensing and registration. Okay. The other sections, that is enforcement and prosecutions. So the officers here will involve in the compliance monitoring, which is based on the documentation that we receive. And also what we'll do is we go to the site to the site inspections, the routine inspection or scheduled inspection, to ensure that the Act 304 and its subsidiary regulations are complied. For example, we look at the facility in terms of equipment, personnel, and also clinical procedure involving ionizing radiations. And if we receive any complaints or we suspect there is non-compliance, so we will do the investigation. And if we have a strong belief that there is a breach, so we might carry out the raiding. Yeah. And for the serious non-compliance, we will carry out the prosecutions. And for the prosecutions, the role of the officer is either to be a prosecutor or the witness. So here, the knowledge of medical physicists is important. If you become a witness, then we can consider it as an expert witness in this area. Okay. The other one is our role is that about giving the medical physics services. And this is mainly normally for the government facility. We only give medical physics services to the government facility. And this is similar to what our counterpart in hospital do, that for example, we do the equipment specification in terms of preparation, evaluation. Yeah, we involve in the procurement of the equipment at the HQ level. Yeah, and we do the site visit and testing and commissioning for the new equipment. And this is for the IR equipment or facility as well as MRI. We also carry out the random repeat test, which is we perform the QC test or performance test of the machine randomly. Yeah. And also develop rules or regulation, code of practice, guidelines, and other related documents to IR as well as NIR safety. And also at the HQ level as a regulator, we develop and monitor the implementations of QAP in Malaysia. And this involves all three disciplines: radiology, radiotherapy, and nuclear medicine. And now we are in the process of establishing the QAP for the dental, yeah? I mean dental x-rays. And also, to a certain extent, we also conduct studies or research on IR and NIR, but our research mainly or primarily related to services that we give. It's not like purely research like what our counterpart in the university do. Okay, and these are examples of the document that we prepare. For example, we have the QC protocols, we have pamphlets, we have posters, and also like we produce the national reports on medical radiation exposure in Malaysia. These are just some of the examples in terms of document that we develop. Okay, last one is the training and interagency cooperation section. So this one, officers will involve in human resource development and capacity building, not only for the HQ, but because we also have our colleague at the state level, so we will provide the training and sometimes also involve our colleagues, medical physicists in the hospitals. Yeah, and this section also involved in development and implementation of certification program for radiation protection officer, which is not yet being implemented now, but at the last stage. So soon in our country, in Malaysia, all radiation protection officer for medical also will need to sit for a certification, for an exam. They have to get the certifications, like what those RPO in the industry, they implement now. And this section also, they will involve in coordinating and provide training, and also for the information dissemination. Okay, that is the main duty, or the one that being already, what we call that, the ongoing roles and responsibility. But also in certain cases, in certain circumstances, we also need to involve in other area. And for example, just to share that now we know that we have a COVID issues in our country and also worldwide. So as a regulator also, we involve in this area. For example, we involve in setting up COVID quarantine center, which of course our duty is focused on the X-ray part. Yeah, and then prepare and evaluate equipment specification for the purchasing, approve, evaluate and approve the equipment and facilities at the COVID quarantine center involving X-ray, and also involved in the preparation of reports in handling of COVID pandemic in Malaysia. Okay, and this is the way forward of my division. We're going to strengthen in terms of security control and safeguards, safety and security culture, also training, because we consider quite new the section of training which is started in 2016, that we have a dedicated section to look into training. And also in terms of medical physics issues, we have to cater with the ongoing technology. And on top of that, non-ionizing radiation also, we are focusing to give more attention to the non-ionizing radiation as well. Right, so we come to my last slide, yeah, that I want to share today. That is the issues and challenges that we face. Yeah, the first one, similar to those our colleague in the hospital doing clinical one, is about the technology advancements. We know that medical physics now, in terms of equipment itself, not only equipment, but also in terms of procedure or protocols that we do using ionizing radiation, is changing, is growing. So because of that, the issues that we face as a regulator is that to have a up-to-date or current standards or protocol or reference with this new equipment or this new technology or this new procedure, because we need to impose control. To impose the control, we need to have a standards on this new equipment or procedure. So this is challenges or issue that we have, because normally in our country, we will need to base on the international documentations, yeah? And on top of that also, in terms of test tool, because when the new technology come out, so we need to have a new test tool. But normally there will be lapse between when we have a new equipment, there is still not yet a new test tool to cater to test the performance of this new equipment. And also definitely the competency, knowledge and skills of the staff, also we need to upgrade accordingly with the technology advancements. And in terms of this, this is not really medical physics issue, but still like the distribution of facilities, just to share, because of geographical or locations of the facilities, especially in Sabah and Sarawak. So there's some issues for us to cover, yeah, the whole premise, as compared to in the Peninsular Malaysia, which is only some areas that we have a remote area that have these facilities. And the other issues that we face is the staffing, because we know that as a regulator, I mean the staff in the Ministry of Health, we are subject to, we might be transferred to hospitals, to other area if you've been promoted or for whatever, for other reasons. So to keep the staff with the who has already been trained and well experienced in the regulatory aspect, with a good clinical knowledge and with a good medical physics knowledge. So sometimes this staff being transferred to, so we have to train a new staff. So again, it's about the training of the staff to keep them, to ensure their competency. And normally when we talk about medical physicists, medical physics, I believe that many of us just focus on ionizing radiations. But Puan Aminah did mention that they also involve in MRI, ultrasound, which is non-ionizing radiation. And on top of that, we must also aware that in medical, lasers, which is non-ionizing radiation, lasers is equipment being used widely in medical. And these lasers also pose a high degree of risk, right? So, but at the moment in Malaysia, we don't have a regulatory framework for the control of non-ionizing radiation. So that's the issue or challenge that we have. Like for example, MRI machine, we can't impose, we can't take action on the MRI machines. We can just only suggest, or I mean, it's an optional, voluntary by the user to comply with what the standard we have. Yeah, we don't have what you call that legal power there to impose on the MRI, even though we know that MRI also is a complex modality that need close scrutinize. Yeah, so regulatory framework is an issue for the NIR and also the competency of medical physicists. I'm sorry to say, my dear colleague from the university, but I think now we focus more on, when we give training to our medical physicists, we focus more on ionizing radiation, but we also must look into the non-ionizing radiation so that our medical physicists also, what we call that, have a well trained in non-ionizing radiations. Yeah, those equipment that related to non-ionizing radiations. Okay, I'm sorry because take just slightly more than the time allocated to me. Yeah, so thank you for your attention.
Okay, thank you, Dr. BD, for giving an overview what Medical Radiation Surveillance Division of MOH are doing. So we move forward to Q&A session. So we have 8 questions actually, but 3 of them already answered by Mr. Woon and Mrs. Azlin. So I go through with the first question first. I'm not sure who's going to answer this one, but I'm going to give the question. Do you think a radiotherapy physicist can work as nuclear medicine or radiology physicist at the same time? Does we have any rules to rule out? In government, there's a lot of physicists at different specialty, while in private management wants only all-in-one physicist. So I think maybe Dr. BD can answer that question.
Sorry for which do you think radiotherapy physicists can work as nuclear medicine at the same time? Does we have any rules?
Yes.
Okay, this one, yeah, we don't specify that medical physicists can work in one department at one time. Yeah, so basically they can work in all 3 departments at one time. The only thing is that whether or not they have sufficient knowledge to be mastered in all these 3 areas. The other thing is that whether or not they can cater, if it's a big center, whether or not for you to carry out this job. But in terms of as a requirements, legal requirements, yes, you can work in these 3 departments at the same time. But it depends on the arrangement in the hospital, whether or not you can cater that. But of course, like if you want to work, because the qualification required is you have to have a master degree in medical physics. And now I'm talking in private sector, right? To work as a medical physicist. So long you have that qualifications, master in medical physics, you can work in either department at either separately or at the same time. So it depends on the work arrangement. Yeah.
Okay,
I have a comment.
All right.
Okay, regarding what Dr. BD has mentioned just now, I just want to ask Dr. BD.
Yeah.
Exactly who determine the job profession in one center actually? Whether this person have to be having a master degree or bachelor degree. So where is it that the role, why is it regulators putting up this such of discriminating profession, like you are not recognized the bachelor degree, but you want it to start with the master or PhD. So why is it that regulators are doing this kind of criteria, put in the criteria for the private sectors? Okay.
This is related to the policy. The first one is the policy of the JPA, that is for the scientific officer for the government. So the enrollment is based on the first degree, right? Another thing is that for the private sector, actually in private sector that we impose to have a medical physicist is in radiotherapy and nuclear medicine, not in radiology, right? So, and normally physicists in private sector, not normally, there are many centers that they only have either only one or two physicists. So because of that, and this private sector, they stand alone. It's not like in the Ministry of Health, even though we are separate hospital, but we are considered as a one entity. So what we do is that this new staff, these new physicists will work under the supervisions of the senior physicists before they are allowed to perform their task. So, but in private sector, they operate separately. So because of that, to ensure that the physicists that work in the private sector are competent and can work, can carry out their work, that's why we impose that for the physicists in the private sector, in nuclear medicine and radiotherapy, they must have this Master of Medical Physics qualifications.
Yeah, because for me is that the competency is a good enough for the persons that applying for the private sectors, because the competency is very important compared to the qualifications. Qualification, you do not know whether they have the training in practice in doing their profession, the profession that they apply to. So this is very important. I think that the best is that you insist on the competency rather than the qualification.
I think we need to have both qualifications and also the competency. And because if you look at the history in our country, this medical physics only offered at the master level. Only lately that we have the radiation physics being offered at the degree level. So that's why when we implement that, so we have to put that medical physicists in the hospital, the private hospital, must have a master degree. And because at that time we don't have this first degree level that teach specifically on the radiations. They only learn the general physics, I mean like applied physics, pure physics, or nuclear physics for UM. Yeah.
Okay, thank you, Dr. BD, for your clarification. So we can move to the next question. It's from Nur Shakira binti Muhammad Bakri. Who is responsible with contouring matter like organ at risk if certain center practice that physicists need to do that, not oncologists? So if something false happening after treat the patient and finally found that contouring is the factor why it is happened, who will be blamed and need to take the responsibility? So maybe I can ask Ms. Woon to answer that question.
Okay.
Yes.
I think you are not the only one who have this kind of concern.
Yeah.
And in this case, I think SOP is important. So now everyone is talking about SOP. So you can communicate with your oncologist, kindly ask them to check your OAR. And generally, contouring is under oncologist's responsibility. So my advice is work out the SOP together with oncologists and radiation therapists. And I hope that answers your question.
I hope so. The participant will be satisfied. Okay, these few questions, a lot of them is to Dr. BD to answer. So get ready, Dr. BD. Okay. Here from Nurumi Hamza. I want to know your take on medical physicists that were stationed at non-hospital facilities. Do you think they have sufficient skills and knowledge if they were to transfer to hospitals and work at radiology department per se?
Medical physicists that were stationed at non-hospital
yes, hospital facilities. So do you think they need sufficient skills and knowledge to give the service?
I'm not sure about this. What this Nur
Hamza.
Hamza, yeah, meant for the non-hospital facility. Do you mean that those who are working in the state health department, or I want to know on medical physicists that workstation at non-hospital facilities, this scientific skills and knowledge if they were to transfer to hospital and work at radiology department per se.
Maybe they're working at the centers, maybe only clinics, most probably. So,
but at the moment we don't have medical physicists working in a clinic.
I think in the might be it's in the university or in the office, the regulators, like regulators or researcher. Might be like that, not related to the hospital.
All right. So basically, because if they already have what you call that knowledge, if they have a medical physics master in medical physics, I think there won't be issue for them to work in radiology department. But if they don't have the master in medical physics, then the attachment would be better for them to have a certain period of attachment for them to refresh their knowledge, yeah, before they can perform their work on their own, alone, independently, yeah.
okay, so as we're talking about this, Dr. Hafiz did a question. I'm wanting you to question about this importance of structured clinical training for medical physics to be clinical competent. So he wants to know from the regulatory perspective, what do you think about the academician side to improve this lacking of the clinical competence of medical physics when they after they graduated for their master's study?
This one is okay, right. Training. To me, this one is because we have to balance out between the time, the training time, the period of training. So we cannot like extend the master program itself, because before this I did there's someone mentioned about compare our medical physics with the doctor, the specialist, doctor. I would like to stress here that our situation and the doctor is different. The doctor, when they did their master, for example, in radiology, so forever they will become a radiologist. It's not that after a certain period, then they will be transferred to ophthalmology and expected to be the specialist of the eye, and then transferred to other department to be specialist of cardiology, right? But for us medical physicists, we have three branches: radiology, radiotherapy, and nuclear medicine. And then later on, when you work, especially in government, I'm not sure about the private sector. Normally, private sector, they will stick to one specific discipline. But in government, you'll be transferred to separate or three different disciplines. So because of that, we cannot like train to have a medical physicists that graduated, that have a master, that have a 100% competency on these three areas. So because of that, the approach, I would say the one that we need to do is that we give them these three knowledge in these three disciplines, but later on, only they develop in which area. So for that purpose, they need to have they have to work under the supervision of the senior medical physicist for each discipline, right? So if they want, if like for example, they are now working in radiotherapy and later on they want to go into nuclear medicine, then they have to undergo attachment on that area, even though they are already senior physicists in radiotherapy. That's my, my thinking. But this does not reflect the stand of BKRP. This is my personal point of view.
Okay, I hope it answers Dr. Hafiz's questions. This one is, I'm sure it's from medical physicists in government. They ask whether they can doing some local in private hospitals. They are medical.
Right. To my knowledge, yes, you can do the locum provided you get the approval from your head of department or hospitals, the director of hospitals. So you must get that approval and then you can do the locum.
Okay, and then I think this is reflecting what Mrs. Azlin talked about. One of them asking you also, how strict is the current implementation of having master degree in medical physics to join the workforce? What about graduates having master in engineering or pure physics? Do the government allow these graduates to work in medical physics field? What's your take on that one, Dr. Bidi?
For the private sector, a medical physicist must have a master degree in medical physics. And for the government, like what Puan Azrin did mention, that we started with a basic degree, and a master degree in medical physics is not a compulsory, but we in the Ministry of Health very strongly recommended that our staff go for master in medical physics.
Okay, I hope it answers your question. This is from Irene Danik. This is from the, I think it's for Dr. Bidi also. It says here, if the physicist is to work in 3 different departments at the same time, that means he must undergo the 20 days logbook for program for the different field. Not sure for different fields, but nuclear medicine especially has the 21 days logbook to be fulfilled before acknowledged to work there. So maybe I can take this question for Mrs. Azlin to answer this one.
Okay. Okay, right. I know the meaning of 21 days logbook because actually in nuclear medicine alone, they have this kind of internship. It means that all the personnel that already start the job in nuclear medicine in the government or private sectors, when they want to start a job, they have to be under probation. So that probation is that they have to go through the 21 days logbook program. So similar to the radiology, I think they have for mammogram. Mammogram for the staff that joining, especially the female one, joining the to be attached to the mammography room, handling the mammography machine. So they have to have a 14 days workforce in the logbook program. So this one is actually for 21 days now is by BKRP, I think is under nuclear medicine alone. This one is one type of the training decided for the module of training for nuclear medicine, especially for all the teams, doctors and medical physicists, nuclear medicine technologists, and nursing. So we have the modules already drafted under the BKRP. So we have to do the 21 days training before we are considered as qualified to be the staff in that center or in that section.
Oh,
so
okay.
For others, I'm not sure. Might be if these physicists can work in 3 sections, so they have to comply to all the sections. What is the mandatory for the training side?
Okay, thank you for the clarification, Mrs. Azlin, about the 21 days logbook. You mentioned about the mammography also. So, Puan Amina, what do you think about that for the mammography part? Is it there's a specific training or like 20 days logbook need to be filled for the mammography program? Puan Amina? Oh, I think we got hang over there. Okay. So I just continue to the next question. Okay, now, on behalf of all the private sector medical physicists, we hope that BKRP can limit private medical physicists to practice one discipline only. So I think this is a request from the private medical physicists. Okay, and then regarding the cert and training, said by Dr. BD, does physicists that involve as academician also need to be registered, Dr. BD?
Okay, this one just now, what I mentioned about the certification is that for the radiation protection officer, right? Is it?
Yes.
I think it's about that. So this certification is for the radiation protection officer. So for the big hospital that have more than one physicist, so only one physicist need to be the registered. I mean, is registered as a radiation protection officer. So if you want to be a radiation protection officer, yes, later on when we implement this certification, this RPO has to sit for the exam. But I have to stress here that this is still in the preparation, and I myself don't involve directly in this group preparing this certifications program. So I cannot say for sure, is there any exclusion criteria for certain groups of people or that may be considered don't need to sit for the certification examinations. So I'm not sure about that. I have to be honest that I'm not quite sure, yeah, because I don't involve directly. I'm not one of the member in this certification. Yeah.
Okay, so this is answer the question by Puan Siti Zubaida, right? For physicists in hospital who pass the RPO exam by AELB, so do they need also to sit for RPO exam under MOH?
So the answer is
yes.
Like I'm not quite sure, but I believe maybe they need to sit for this one because we want this one is we cater for the medical setup.
Okay.
Yeah.
All right. So this one participant did ask: is it compulsory physicists in radiology in private sector? Is it really compulsory? Because I think it's mostly on a private sector, you know, because most of them are working in RT, radiotherapy department and nuclear medicine. So is it compulsory to have physicists in radiology itself?
At the moment, no. We haven't yet have that regulations, but in the future, I cannot say for sure, but depending on but again, if we're talking about radiology, we must look into the equipment that they have, not just simply a radiology department. If they just have one, general X-ray machines, then I personally think that we don't need to have a medical physicist to handle a department that have one X-ray machines. But if you're talking about have CT scan and the rest, and maybe. Yeah.
Okay. Ms. Woon, there's I think this is from the radiation therapies. It says that what is your opinion to people that currently the role as a radiation therapist but changing the career to be a medical physicist? So what your take on that, Ms. Woon?
Sorry, what is the question again?
Regarding medical physicist role, what is your opinion to people that currently role as radiation therapists but changing their career to be a medical physicist? I think this is radiation therapist as a radiographer, I think.
Oh, yeah.
And they want to change the career to be a medical physicist.
Well, of course they can do it. Since they will, of course, undergo the bachelor degree, I think. There's a bachelor degree for the radiotherapist and under the medical physics. So actually, I think they have experience in setting up patients. When they convert, when they change their scheme into medical physicists, they actually have advantages. They know how to set up patients, and then at the same time, they know how to do the planning. So I think it's a benefit to if they started with radiotherapists and become medical physicists later.
Okay. All right. There's a lot of questions too about this. Is there any plan to look into competency of single physicists to work all in 3 disciplines? Radiotherapy, nuclear medicine, and diagnostic imaging. It sounds challenging to private setting. This is mainly from the private setting medical physicists. So it sounds challenging to private setting medical physics to force to work in all discipline, while other countries, they do have separate medical physics for each discipline. So I think this is, I think as Dr. BD told us just now, it depends on the center itself, whether they want this medical physicists to involve in 3 disciplines. Okay, what else? Okay, what is the current situation in regards to vacancy as medical physics in government hospitals? I think Dr. BD can answer that. What is the current situation in regards to vacancy as medical physics government hospitals?
I don't have the figure with me about the total posts and also the vacancies in the Ministry of Health. Maybe if, since Ms. Poon also working for the Ministry of Health, do you have any idea, Ms. Poon, about how many vacancies that we have at the moment in Ministry of Health? I don't have a figure with me. I'm so sorry. I don't have a figure.
Okay.
Yeah.
Okay. Okay, so this person interested in medical division, that it says, does your center offer any training opportunities for medical physicists who are on the end of their study? So I think they want to do internship.
Yeah. All right. Okay, so in terms of internship or what we call the industrial training, yes, we do accept students. In fact, at the moment we have a few students from the universities but at the degree level doing internship at our office now. Yeah, so yeah, we do accept. What you need to do is that just write a letter through your university, definitely, that mentioning your intention. We can consider that. Yeah.
Okay, I can see there's one attendee raise his or her hand. So do you want to talk to any of the speaker? Husna Nabila, you did raise your hand, and maybe you want to ask question to any of the speaker here. Okay, then if not, then we continue. For the medical physics, I think government and private have different job description. Does regulation have specific job description that standards for both sectors, especially in radiotherapy? What do you think about it, Dr. BD?
No, in our act or regulation, it doesn't specify so detailed about this job description according to the disciplines of medical physics. It just provides in general about what medical physicists should do, but it doesn't talk about the segregations of these 3 disciplines for the medical physicist role. Yeah.
Okay, so there's another 2 of question here. I believe the regulatory department shall look into the job description of the medical physics in private setting, again, from the private setting. So if there is no regulation from BKRP, the medical physics is forced to be RPO, laser officer, clinical work, as well as management work in all 3 disciplines. So what do you think about it? Would it be too heavy to be in this role as medical physicists, especially in private sector?
Okay. We have, this is a good suggestion, but at the moment, again, like the roles of the regulator at the moment, we don't go up to that detail. But I also would like to hear opinion from our senior physicist, Puan Azlin. Maybe Puan Azlin can share her, opinion as a senior physicist and working in the hospital environment, that you know better than me in terms of the burdens or workload of this medical physicists in hospital.
Yeah, thanks, Dr. BD. We work together in laser group also to set up the guideline. Okay. All right. For my experience, first thing is that for me to be a medical physicist and to have all these tasks is one kind of opportunity. This is the opportunity for me. I'm going for 28 years already servicing in as a physicist in the hospitals. So this is an opportunity actually, but you have to go step by step to be all these experts. The thing is that if you look at the task that you're going to have to be a radiation protection officer, you're involved with the laser, you're involved with all kinds of medical physicist profession job. So the thing is that from my experience, I started with radiology. I started my job with radiology, whereby my qualification is industrial. My qualification is under the nuclear science, physics nuclear, whereby I'm under the industrial. So I got a job in the medical sectors, and I can use all my knowledge and I just adopt that knowledge to use in the medical. So first thing, I joined the radiology side. Then I goes to the nuclear medicine. Okay, bit by bit, I was pulled into the radiotherapy for a while. At that time, we do not have any radiotherapy physicists, only me and Mr. Koo. So after a while, because of the there's no physicist in radiology and nuclear medicine, I was pulled back in that manner. So now, actually, starting from 2005, I've involved with all these three. So bit by bit, if you can see your knowledge, you can merge together the same basic knowledge, because all this section will use the same knowledge like equipments, all that. So actually you can absorb your be the to be in all these tasks actually. So bear in mind, do not forget the knowledge that you have. So you need to apply. That is the specialty when you work in hospital. You can meet all types of modality, not only ionizing radiation, but also non-ionizing radiation. So from that knowledge, actually, you can use all this knowledge similarly for all the modalities. The only thing is that the function of the modalities will be different. So the use is that for patient care. So the safety also, you can merge. Some of that you can merge. Some you can split it up based on the specialty. So actually, you do not have to worry about the lot of stuff given to you. You have to base on your knowledge and experience, but you are open to ask other your colleagues to give you the ideas actually, but you have to slowly work into the same the what we say is that a similar focusing target actually. So the focusing target is that either you choose you need to do a hard work or smart work. Your smart work is that you gain knowledge from your colleague. Your hard work is that you have to gain the theory from the books. So I think the conversation between the clinician and also the colleagues will get you to we get your knowledge up to the level that you want to. So this is my advice. Do not worry about that. Accept that as a challenge, but you have to trust and confident when you do the work. So please do ask your colleague if you do not really know about it. So that is a way of communication strategies.
Okay, thank you, Puan Azlin, for the explanation and for the answer. So I think we're already ahead of time, so I need to end this session. But thank you very much. We have a lot of questions, and one of the, just to tell you, Mr. BD, that this is from the private management perspective. So it says that, I think this is a concern from them. So if there is no guideline or rules from MOH about the limitation of physicists' role in different departments, then one physicist can fit all, which is not ideal for patient safety. So it seems like it's cheaper to hire one than three. So maybe this is the concern from the private setting. So maybe you can look at it, all right?
Yeah.
So
yeah.
yes.
Can I just quickly answer to? I mean, add to that. Definitely,
Yes.
definitely. If the center asks the physicist to do more than one job, I mean, working at two different department, definitely we will look into the workload of into the workload, and we will question whether or not this is can be done by one physicist. Yeah.
Okay.
We look into that way, but we don't have like we don't have a rules saying that must work in one department. But we will definitely look into workload whether doable or not.
Okay, so I need to end this session. It seems like this session can go on for hours because regarding about medical physicists' work. Okay, thank you for all the great lectures that all the speakers have done. Thank you for your perspective, your experience, your shared experience in your roles and current issues of medical physicists in medical physics field. So do the participant do take your QR code for feedback and attendance. So then you just fill in your feedback and we give you your e-certification. So do not forget for tomorrow, last day for the event of medical physics research collaboration. All right. So Assalamualaikum warahmatullahi wabarakatuh. Thank you all to those who participate and to all the excellent speakers. So, and our host also, thank you very much. So Assalamualaikum warahmatullahi wabarakatuh and goodbye. Have a good day.
Waalaikumsalam. Thank you.
Goodbye.